I am a medical doctor who has specialized in public health. I deal a lot with lung health. This is a disease which commonly affects the lungs. It may affect other parts of the body, but the most common part it affects is the lungs. Tuberculosis is caused by a germ, which usually is airborne, and one of the common symptoms that it has is coughing. And that person who has TB, if they cough out, they can bring out the germs into the air, and anybody else who inhales, as we all breathe in and out, we are at risk of getting infected, which mainly include coughing, having high temperatures, having night sweats whereby you sweat so much until even your bed sheets are wet, and also you may have unexplained weight loss. Those are the main signs and symptoms. And we always say that when you have a cough of any duration, suspect this could be TB and you should come for screening. TB treatment cures the condition, and the treatment is about 6 months, usually if it is the uncomplicated TB. And then there is TB which may be difficult to treat in the sense that it is not responding to the normal TB drugs. For this kind of TB, we will treat you for longer. We may give you injection. Your treatment may be up to 9 months, or even it may be up to 20 months, depending on what we prescribed for you. The reason being, some people may not be aware of what the signs and symptoms are. And also, maybe people fear that if I have a cough, this could be TB, and they feel that they will be discriminated. So they don't come forward for screening. We would encourage many people to come forward for screening, because as long as there are those unidentified people in the community who have TB, tuberculosis continues to be transmitted. Because these same people are coughing it out as they breathe in and out. It is out there in the air, and those who do not have it can inhale the germs and get the condition. So we recommend people who are coughing for any duration, anybody who is having fever, weight loss which is not explainable, night sweats, just present yourself for screening. Encourage your family members if you notice that. Encourage your colleagues if you notice that to come for screening. The dangers of not taking the medicine as prescribed is that you can allow the treatment, you will make the treatment be incomplete, and even as you can make the germs not to respond to the treatment, making you at the risk of developing the complicated TB, which has a very long duration of treatment, and the side effects of that long treatment will affect you to the extent that even you may not be able to do your usual work. You will find it affects your whole family. You find that you become more of a burden to the family, because other than just receiving that treatment, you also need the nutritional support. You need more social support.
My name is Evelyn Kipuchi. I'm the Chief National Coordinator, Stop TB Partnership, Kenya. This is an organization that does advocacy around tuberculosis in this country. So it supports the National TB Program in advocacy and communication matters. Kenya is one of the countries that have high burden of TB globally. It is among the 30 countries in the world that have reported over 80% of TB that is in the entire world. Kenya is rated number 4 after South Africa, Nigeria, Ethiopia, and then Kenya becomes number 4. We have 10 counties that have been ranked as the counties that have the highest burden of TB. And Nakuru is one of those counties. Others include counties like Mombasa, Nairobi, Meru, Machakos, Turkana, Kisumu, Homa Bay. There are factors that make those counties have high TB burden. And if you look at those, most of those counties are counties that have been growing. Most of them are cities, and others are those ones that are growing to becoming cities. So if you look at the socioeconomic conditions of those counties, they are almost the same. There are counties that are cosmopolitan. There are countries that are highly populated. There are countries that have challenges in housing. There are counties that report high levels of congestion. Congestion is one of the factors that predispose people to tuberculosis. Reason being that there's no free circulation of air, and so if one person is infected, then he's likely to infect other members of that household or even the people they live with. So that is one of the factors that make Nakuru a high TB burden county. Other factors include lack of awareness. A survey that was conducted in 2016 reported that as a country, we are missing about 40% of people who have TB. They don't know they have TB. They have not even sought treatment. That means they are busy infecting others. And those are things that we need to address. Why would somebody be having TB and has not sought treatment? Only about 30% of people with TB have HIV. 70% only have TB. The only problem is that the highest cases of TB are to be found among the poor. For this reason, the poor are likely to live in congested places with houses that have no ventilation. They are likely to be traveling in congested public service vehicles like matatus. Therefore, they are likely to be infected. So the fact that people think that TB is for the poor brings a lot of stigma. So we need to address that misconception. Anybody can get TB. First, we need to address the housing situation. If you walk around and look at how the houses are built, you find that they have either very tiny windows or windows that are not facing a natural source of light, which is a factor that can increase chances of one getting infected with TB. The TB bacteria thrives best in a condition that is not well aerated and that does not have direct sunlight. And those are some of the conditions that are in our living houses. And we would want to challenge the Ministry of Housing that when they are developing basic policies on basic conditions of housing, they need to have communicable diseases in mind in our houses, in our institutions like schools. I'm majorly concerned about the structures in our schools, for example. When education was made free, there was an upsurge of registration, enrollment in schools, but the infrastructure remained the same. So you find that a class or dormitory that had been constructed to fit 40 students, where they have bunkers or decker beds that go up to three decker beds. This room was built for 6 people. It has 12 people. That is very dangerous for TB infections. And we're also urging the Ministry of Education, when they're talking about free enrollment, let them also think about infrastructure in light of communicable diseases. Nakuru is a fast-growing town, almost becoming a city. And as it grows, it's exposed to all the ills that come with developing of cities. I want to address the citizens of Nakuru and tell them, if you have a cough, you have lost weight, you have lost appetite, you're feeling sickly, don't wait. Wake up today, go seek medical care. To the leaders, Nakuru is one of the 10 high burden counties in Kenya. One of the biggest gaps is funding for TB interventions. I will urge the leaders to look into their county budgets, especially for health, and ensure that there is adequate allocation that ensures that we have adequate diagnostics, adequate facilities for treatments, adequate healthcare workers to handle the burden of TB in the county, and also ensure that we are investing in creating awareness in Nakuru.